Welcome to Post-Birth Warning Signs, the nurse's role in preventing maternal morbidity and mortality. This educational course was developed by AWHONN to address our nation's rising rates of maternal death during the postpartum period. To date, there is no nationally accepted or widely used standardized message, educational tool, or method for teaching all postpartum women to recognize potentially life-threatening warning signs of post-birth complications. The material presented in this course is intended to fill this need. This course is divided into 3 segments. Once you have completed the course, you may access the online participant evaluation and the C&E certificate. On the right side of this player window, you can track your progress using the Menu tab, or follow along with the narrator using the Notes tab. Before getting started, it may be helpful to visit the Resources tab and download any supplemental materials related to this course. Please take a moment to read the disclosure and accreditation statement. The purpose of this educational offering is twofold. First, AWHONN developed this program to heighten nurses' awareness of the post-birth warning signs that indicate potential complications associated with maternal morbidity and mortality during the postpartum period. The lack of understanding of these warning signs on the part of both providers and women has been identified as a key contributor to preventable maternal mortality. Second, this educational program is designed to provide nurses with the knowledge, skills, and tools needed to incorporate teaching on standardized post-birth warning signs into postpartum discharge education for all women. By the end of this course, you will be able to describe the leading causes of maternal mortality in the United States, identify post-birth warning signs for potentially life-threatening complications using AWHONN's post-birth acronym, differentiate between signs of potential complications that require immediate attention and those that require prompt attention, integrate post-birth warning signs into postpartum discharge education for all women prior to hospital discharge. This course is divided into 3 sections. 1. Problem. Maternal morbidity and mortality are rising in the United States. More than 60% of all maternal deaths occur during the postpartum period, defined here as up to 1 year after birth. 2. The message. The key message emphasized in this presentation is that teaching postpartum women to recognize post-birth warning signs can empower them to obtain appropriate medical care when needed. 3. The integration. Through this course, you will expand your knowledge of maternal mortality and learn how to incorporate consistent messages about warning signs into discharge teaching to all postpartum women. Using AWHONN's post-birth warning signs checklist to teach women about the warning signs can improve their care. Each section of this course will conclude with a knowledge check to help reinforce your understanding of the content. You will not be able to continue to the next section without correctly responding to the knowledge check question or statement. This first section of the course provides an overview of the trends in maternal morbidity and mortality in the United States to give you some background and understanding of their prevalence. Rates of maternal mortality are often used as a measure of the quality of health care and well-being of a nation, because factors affecting the health of entire populations can also affect the mortality rate of women and their infants. Although it may be hard to believe, the United States is the only developed nation that has rising maternal mortality rates. Alarmingly, more than half of the pregnancy-related deaths in this country occur during the postpartum period, after women leave the hospital. Several research studies have shown that the majority of maternal deaths in the United States, particularly those related to obstetric hemorrhage, embolism, and hypertension, could be avoided with appropriate standards of care and education. Amnesty International has poignantly stated the following: given that at least half of maternal deaths in the United States are preventable, this is not just a matter of public health, but a human rights failure. Acknowledging these alarming statistics is the first step. Because nurses provide most of women's postpartum education, nurses can significantly influence the type and amount of information women receive prior to discharge, which has the potential to improve outcomes during the postpartum period. Pregnancy-related death is defined as the death of a woman while pregnant or within 1 year of pregnancy termination, regardless of the duration or site of the pregnancy. from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. This graph shows that maternal mortality rates in the United States have risen dramatically in the past 25 years. Although these data show the rate of maternal deaths decreasing slightly in 2012, in a recent study of death certificate data, researchers suggested the rates may actually have been much higher than what is shown here. The increases measured during the past few decades may be due, in part, to more accurate reporting and changes in etiologic factors. Unfortunately, more than 600 women die each year in the United States as a result of pregnancy or childbirth complications. When women die during pregnancy, during childbirth, or soon after birth, it is a tragedy for their families and for society as a whole. While the U.S. maternal mortality rates continue to rise, international trends show maternal mortality is decreasing. The United States spends more on healthcare than any other country in the world, with access to leading medical research and innovative technology. It had the highest rate of maternal deaths among developed countries in 2008, with the trend continuing to climb. In countries such as France, Germany, Israel, Italy, and Sweden, maternal deaths are decreasing. Findings show that the United States has a long way to go when it comes to identifying and caring for women at risk of pregnancy-related complications. The leading causes of maternal mortality have changed over the past decade. For example, the higher pregnancy-related mortality ratios during 2009 to 2011 are due to an increase in infection and sepsis deaths. Maternal deaths from cardiovascular diseases also increased in that time. Maternal deaths resulting from hemorrhage, thrombotic pulmonary embolism, and hypertensive disorders of pregnancy have been shown to be the most responsive to prevention through appropriate education and implementation of standards of care. What are some factors that account for increases in maternal mortality rates in the United States? We have better reporting and surveillance through, for example, the modification of the U.S. Standard Certificate of Death in 2003 to include a checkbox to indicate a recent pregnancy. Progressively rising rates of cesarean births led to more repeat cesareans and increased risks such as obstetric hemorrhage. Women are getting pregnant at an older age, and older women have a greater chance of developing medical complications than younger women. The nation's obesity epidemic has contributed to risk for maternal morbidity and mortality by resulting in increased hypertension and diabetes. Rates of chronic diseases such as heart disease, hypertension, and diabetes are rising. Chronic diseases account for approximately 25% of all maternal deaths. Notably, women who are in poorer health when they become pregnant often do not get the care they need to treat chronic conditions. Although a chronic disease puts a woman at greater risk of complications, any woman can experience complications of pregnancy and childbirth up to 1 year after birth. This slide shows maternal deaths by race and ethnicity. Racial disparities continue to persist in pregnancy-related mortality. Black women are 3 to 4 times as likely to die from a pregnancy-related death as white women, and almost 3 times as likely to die from pregnancy-related causes as women of all other races. This discrepancy in maternal death rates between black women and white women is almost double that of 100 years ago. Understanding the timing of maternal deaths is important because many of the risk factors for complications associated with maternal morbidity and mortality may not be clearly identified before a woman is discharged from the hospital following birth. This graphic shows that about 61% of all pregnancy-related deaths occur during the postpartum period. Of these, 20.8% occur in the first 6 days following birth. 26.6% occur from day 7 through day 41, and 13.5% occur between 42 days and 1 year following birth. Considering these data, it is important to note that once a woman is discharged from the hospital, she needs to rely on her own recognition of potentially serious symptoms and her own judgment about whether to obtain immediate or prompt medical attention. For each maternal death, a much larger number of women experience maternal morbidity, and that number continues to grow rapidly. Severe maternal morbidity is defined as physical and psychological conditions that result from or are aggravated by pregnancy and have an adverse effect on a woman's health. The red line indicates a significant increasing trend in severe maternal morbidity between 1998 to 1999 and 2010 to 2011. In 2010, severe maternal morbidity affected approximately 52,000 women during delivery and postpartum hospitalization. In 2012, this rate had risen to more than 65,000 women each year. The impact of maternal mortality and severe morbidity on women and their families is far-reaching. These complications can result in increased medical costs, extended hospitalizations, and long-term rehabilitation. Further, the higher need for medical care, social support, and possibly lifelong medical consequences logically causes additional strain on the new mother and her family. Read the scenario and select the appropriate answer to the question. In this section of the course, we will examine the key messages that are important for nurses and other healthcare professionals to communicate with all postpartum women. AWHONN strives to improve postpartum discharge education, acknowledging that early recognition of warning signs can lead to earlier diagnosis and treatment. A standardized and evidence-based approach to teaching postpartum warning signs can benefit all postpartum women. Key messages to be conveyed and discussed with all postpartum women prior to discharge include the importance of recognizing the signs of potential complications of childbirth that can occur after hospital discharge, responding to the signs and symptoms of potential complications by calling 911, going to the nearest hospital, or calling a healthcare provider, as indicated by the situation. Remembering to tell all healthcare providers, including emergency responders and emergency department personnel, the date of childbirth, because signs and symptoms may be specifically related to postpartum complications. In 2015, AWHONN convened an expert panel of perinatal specialists and conducted focus groups of nurses to elicit data on how and what nurses taught women about maternal postbirth warning signs. This was a crucial first step in a year-long project, supported by Merck for Mothers, and aimed at identifying and developing resources needed to educate nurses and women about postbirth warning signs of pregnancy-related complications. Primary themes that emerged from these focus groups included the following. Much of the information and education provided to women following childbirth was focused on the baby, including such topics as bathing, newborn assessment and care, and situations that should prompt a call to the pediatric care provider. Women were receiving inconsistent or inaccurate information about maternal postbirth warning signs. Warning signs for pregnancy-related complications were not the focus of the education because other pressing needs such as breastfeeding, bathing, and wound care took precedence. All postpartum women did not receive the same messages because teaching was often based on the nurse's assessment of each woman's real or perceived risk. To address these issues, AWHONN created a standardized approach to discharge education about the warning signs using the acronym POST-BIRTH. The acronym is designed to help women remember key signs for cardiac disease, obstetric hemorrhage, severe hypertension, venous thromboembolism, infection, and postpartum depression that can result in maternal mortality and severe morbidity. Each letter of the words post-birth indicates a complication that can result in maternal death or injury without timely medical attention. Using the post-birth acronym when teaching women to recognize signs of potential complications has the potential to prevent maternal death and reduce severe maternal morbidity in the postpartum period. On the slide is an image of a section of the AWHONN Save Your Life patient education resource for women to take home after giving birth. Later in this presentation, you will learn about the discharge checklist that helps guide the nurse through the process of providing this education, As you can see, it is important to differentiate signs requiring immediate medical attention from 911 or a hospital, identified in the red box in the graphic, from those requiring prompt medical attention from a healthcare provider, identified in the yellow box. During discharge teaching sessions, encourage all women to put this handout in a place where they can get to it easily, such as on the refrigerator door. A1 also suggests that women share this information with family members and friends. You can find a downloadable PDF of this handout in both English and Spanish under the Resources tab at the top of your screen. The signs associated with the letters in the word post remind women to obtain immediate emergency care. P. Pain in her chest may indicate a cardiac event or a pulmonary embolism. O. Obstructed breathing or shortness of breath may suggest either a pulmonary embolism or a cardiac condition. S. Seizures may likely be related to eclampsia. T. Thoughts or feelings of wanting to hurt herself or her baby may be associated with severe postpartum depression. It is important to teach all mothers to call 911 or go to the nearest emergency room when experiencing these warning signs. The signs associated with the letters in the word birth remind women to get prompt medical attention. B. Bleeding that is soaking through 1 pad an hour, or blood clots the size of an egg or bigger, could indicate an obstetric hemorrhage. I. Incision that is not healing or increased redness or any pus from the episiotomy or cesarean site may suggest an infection. R. Redness or swelling in the calf area of the leg that is painful or warm to touch may signify deep vein thrombosis or DVT. T. Temperature of 100.4 degrees Fahrenheit or higher, or bad-smelling vaginal blood or discharge, can also indicate an infection. H. Headache that does not improve, even after taking pain medication, or bad headache with vision changes, or pain in the upper right quadrant of the abdomen, may be associated with hypertension or post-birth preeclampsia. When experiencing these warning signs, women should call their healthcare provider or clinic to obtain prompt medical care. Discussions with women should emphasize the importance of calling 911 or going to the nearest emergency room if any of these symptoms worsen or the healthcare provider can't be reached. As providers, encouraging all postpartum women to trust their instincts and call their healthcare provider or clinic if they are just not feeling right is critical. Women experience a myriad of signs and symptoms associated with normal physiologic and psychosocial changes during the postpartum period. Nurses can help women understand how to differentiate signs that are normal from those that are not. This can help women determine when to obtain medical attention based on the symptoms they are experiencing. Emphasize the importance of teaching women to tell the 911 operator, emergency room clinician, and their healthcare providers that they had a baby in the last year. For example, I had a baby on January 1st, and I am having a bad headache and blurred vision. Or, I had a baby on the 15th of May, and I am having trouble catching my breath and chest pain. This information will alert the healthcare provider that the symptoms the woman describes may be related to a recent pregnancy or birth. Offering this information is particularly important when women arrive in the emergency room, because emergency providers may not be aware of a recent pregnancy or make an immediate connection between the presenting symptoms and their potential association with pregnancy. Read the scenario and select the appropriate answer to the question. In this final section of the course, you will learn about strategies for integrating the key messages about post-birth warning signs into discharge education. Doing so for all women can save lives. A1 asks postpartum nurses what they know and perceive about maternal morbidity and mortality, and whether or how they incorporate this information into routine discharge planning and education.